those organizations don't survive post-disaster because they didn't know what was going to happen or they didn't put preparedness efforts in place prior to a disaster occurring. One of the biggest challenges is bringing emergency management and emergency preparedness to these organizations so that they can be prepared for whatever disaster occurs.
Hi, everyone, and welcome back to COVID-19 Heroes. Today on the show, I'm introducing Ed Colson, a fellow emergency manager. Ed is currently serving as the Public Health Emergency Preparedness Coordinator for Tillamook County in Oregon. Since I know that emergency management is a little bit of an obscure field still to many, I asked Ed to explain what it is that we do in and outside of the COVID-19 response. Ed also shares what the advantages and inconveniences are of working and living in a rural community during a global pandemic. Hi, Ed. Thank you for being on today's show of COVID-19 Heroes. Welcome.
Well, thank you very much for the invitation there.
So, almost every time I introduce myself to someone as an emergency manager, they think it means that I work in an ER. You are an emergency manager as well. Can you explain what emergency management is?
Yeah, so it's interesting. Sometimes I get the same question, what is emergency management? Because they think back to that movie Volcano with Tommy Lee Jones, and he's out in the field, he's jumping over lava. And then when I explain to them what emergency management really is, it doesn't come off so exciting sometimes, but it's certainly a valuable profession to be in. Emergency management deals a lot with the planning and preparedness, mitigation, response, and recovery of the community and helping them be prepared for a disaster, whether it's from a natural hazard, a technological hazard, a man-made hazard, making sure that there are plans in place to prevent those or mitigate them, their exposure. And then once they occur, then ensuring that we have the proper response protocols in place and then respond effectively and then help the community recover.
So, what does being an emergency manager during this pandemic translate to?
It translates to a lot of meetings, a lot of understanding. It's unique that this is a pandemic response. Emergency management, although in its response for natural hazards, pandemic is one of them. There's a lot of information out there that emergency managers are relying on from the public health side. So this is a great opportunity where public health and emergency management are working together, where public health knows the science and they know what the virus does, and emergency management is able to complement them by providing them the means to be able to protect the public, get out the necessary PPE or personal protective equipment, and then help out in the community response to protect them. So this is a great combination where emergency management, with all of their skills in knowing their community, knowing what resources are out there, are able to complement public health's response in tackling this virus and pandemic that we're experiencing.
You are currently serving as the Public Health Preparedness Coordinator for Tillamook County in Oregon. Tell us a little bit about how you have been involved in the COVID-19 response.
So, as the Public Health Emergency Preparedness Coordinator for the county there, I have been helping the health department prepare their operations by getting the necessary PPE in place, and then working with the hospital and other social service and healthcare facilities within the county, which include nursing homes, dialysis centers, urgent cares, private practice clinics, and connecting all of them together to be able to develop a coordinated response for the COVID-19. It's something that we have started the planning process actually a year ago, just for general hazards that Tillamook County is expected to face in the form of like earthquake and tsunamis. And so the pieces were in place, and all it was just bringing everybody together and making sure that everybody's plans worked in accordance with one another and that everybody had everybody's number or contact information. That's a lot of emergency management, is ensuring that you know who to ask for and you know who to talk to if you're going to need something. So a lot of that was in place. And then once COVID-19 happened, we brought it together and we focused it a little bit more on the particular type of response towards the community that we were looking for.
As we're recording this, it's currently Friday, April 10th. What is the situation currently like in Oregon and in your county specifically?
So in our county there, we're looking at, we currently only have 4 cases. as of today during our recording. And then for the state of Oregon, Oregon has had a relatively mild impact as of right now. We are kind of wedged in between Washington and California. And so we know how bad things were getting in both of those states. But currently, right now, we have just under 1,400 cases in the state of Oregon here.
What are some of the advantages and inconveniences of living and working in a rural community like yours in Oregon during a pandemic like COVID-19?
Oh, that's an excellent question. Rural communities are very tight knit and very close. And a lot of the time, when you work within a disaster response, many of the people who reach out to help are doing multiple jobs or they have multiple roles within the response organization. And the volunteer outreach that occurs in rural communities is so beneficial because everybody's really wanting to come out and be able to help. So that's a big plus. On the other side of that, though, is the fact that because it is a rural community, the resources that may be found in a larger metropolitan area, such as more hospitals, larger emergency management staff, isn't there. And so it's balancing between the two. In our county, we have one hospital for the entire county, and they're doing a phenomenal job. But it's really one of those things where you wish you would have additional support to be able to make sure that everybody is taken care of. And I know that's across the nation. Rural communities are doing the best that they possibly can. But those are pretty much the pluses and the minuses of work in emergency management for a rural community during this time.
So clearly, it's a really good thing that there aren't a lot of cases in Oregon and in your rural area, but that also means that very few people will likely be immune to the virus. Do you think your population will be at greater risk once the shelter-in-place orders are lifted?
That's a very good viewpoint on that. One of the big things that the community that I serve in Tillamook County, it's on the coast of Oregon. And so there is a lot of vacation rentals and a lot of beaches that people from the interior like to come in over to the coast and visit. And so one of the biggest worries for the communities that are out there is that while they may be protected by themselves, it's the influx of visitors that come in to stay or to go and visit, or that was happening at the beginning of this lockdown, that was concerning them maybe bringing exposure of the virus to their smaller communities. And especially when these communities, most of the full-time residents there are in that vulnerable age above 55 years old. So there was real concern about viruses or carriers of the virus coming over and infecting those communities. Otherwise, they would have been fairly isolated from the impact. And so that was a concern and one of the major reasons why Governor Brown of Oregon instituted that stay-at-home order. We're going to see the reverse of that if an order like that is lifted and more people want to go out, especially when the weather is nice toward the coast. So that risk exists out there. Although being a rural community, having those views and the coastline that attracts people, that's a big concern for a lot of the community members who are living out in that area.
You are also the chair of a medical advisory group and a private-public partnership coordination group that was specifically created for COVID. How would you describe the partnerships that you have seen or been involved with?
They have been very beneficial. They have brought together not just the medical advisory group, which consists of social service agencies and other healthcare providers and practitioners. They've not only brought them closer to working in coordination with the health department, they've also brought them closer working in coordination with each other. And I think that's a big plus when it comes to working and organizing industry groups and community groups in emergency management, is you bring a lot of people to the table to start that relationship between emergency management and those groups, but then also between them so that they can rely upon each other, share best practices. When it comes to the private public partnership group that we have, we get a lot of the infrastructure, the ones who run the utility, the airport, the ports, the school districts, all in one room now virtually, where we are able to discuss what everybody is working on. And that same kind of networking and conversation happens where school districts know what the plan is from the transportation department or the public transport. So you have a lot of that coordination going on and collaboration that's needed for everybody to get their plans all on the same line, because especially in smaller communities where one parent may work in a school district and the other for the utility, knowing what each one's plans are when it comes to maybe childcare or being able to help members in their own neighborhood, it's very crucial to making a response successful.
You have been working for a while now with small and medium sized businesses. What are some of the biggest gaps that you have seen in disaster preparedness for those businesses?
So, small and medium sized organizations are so vital to the recovery of any community. But one of the things that we start to see is that they may not have the experience or they might not have the capacity to bring on somebody who is in emergency management full time or has a background in emergency management to be able to prepare their businesses for, COVID-19 now, but it could be an earthquake, it could be a tornado, a wildfire, or something else that may occur tomorrow. And so, whenever these disasters occur, they put in a tremendous strain on the organization and the leaders of those organizations to identify what do we have to do to prepare and respond so that we can safeguard our employees and ensure that our doors will be open tomorrow. And a lot of the time, those organizations don't survive post disaster because they either didn't know what was going to happen or they didn't put preparedness efforts or mitigation efforts in place prior to a disaster occurring. And so that's one of the biggest challenges is bringing emergency management and emergency preparedness experience and bringing a program to these organizations so that they can be resilient and prepared for whatever disaster occurs.
So, in emergency management, we do a lot of continuing education. And I remember a while back sitting in a class on disaster recovery. And one of the big things that I took away from that class was the fact that following a major disaster, if a small mom and pop shop is closed for business for about a week, it is likely to never reopen again. For a shop that is part of a larger group, like Trader Joe's or Ralph's, if it's closed for 30 days, then that little shop is likely to never reopen again, simply because of the economic impact that is so great. Now, a lot of grocery stores are still currently operating, but there are a lot of other businesses that have had to shut their doors. What is your community doing to support those small business owners currently?
Yeah, so in this particular situation that we're dealing with COVID-19, a lot of those smaller shops, especially when there's a large tourism industry, aren't seeing that influx of people anymore. And so, what we're trying to do is really get out the word towards the local community that our restaurants are still open, even though we've switched over from in house dining to now takeout or delivery. We want to be able to still provide our smaller and medium sized businesses the opportunity to continue going in business, but just switching their mode of delivery. And that is hopefully going to keep a majority of them afloat. And so that's a crucial portion of it. Then we also notice that we have our lodging, our hotel and motel industry that relies upon people coming to the coast and staying there. And those are having a large impact. And so we're trying to work with those providers to possibly partner when it comes to taking care of either patients or people who have to be discharged from the hospital so that we can continue to have revenue going through our community there. If we take a look at this nationally, there are so many industries from hospitality to tourism to retail that are going to take a tremendous hit. And whatever they can possibly do to keep their doors open, I'm starting to see people advertising online sales with curbside pickup. So you're starting to see organizations that can be very quick and transition to a different mode of delivery to continue that revenue stream. But unfortunately, for those that can't, this is going to be a very trying time, not just the last 30 days, but at least the foreseeable 6 months to a year as to how they're going to be able to continue in business and provide services, whether it's in the environment they were operating in beforehand or in a different set of operating criteria or environment going forward.
Coordinating resources is a big part of any emergency manager's job because resources are always scarce following a disaster. And COVID-19 makes it obviously so much harder because we're not just dealing with a local shortage this time around, but with a global one where we just don't have supplies coming in from anywhere. How have the public-private partnerships or any other measures that you have been involved with tackled this issue?
We're experiencing those shortages as well. But what we're seeing is a lot of the industries that may have those stay-at-home orders and they aren't able to see their customers or their patients. A lot of donations have come across, both to the state and locally, saying here is some masks that we don't use anymore because we're not doing as much construction. So they've donated N95s, or they're donating gowns and gloves from the local optometrist or doctor's office because they're not doing anything anymore. So we're seeing a lot of outreach from the private sector offering donations to the state and to local authorities and health departments. But then we're also seeing, especially in Oregon, we're seeing a tremendous craft making when it comes to handmade masks, plexiglass face masks for the hospitals. So we're starting to see a lot of community made donations, companies that don't need the material anymore, they're donating. And then even some of the firms in Oregon in the high tech sector are transferring their operations from making computer chips to now making personal protective equipment because they have the capacity and the ability to. So while we are dealing with this shortage nationally, in the state of Oregon, we're seeing a lot of help coming in from the community, once again, pouring out their support and postponing their particular whatever they're making. I've even seen and appreciate the distilleries and the breweries, of which Oregon is known for, transitioning to making hand sanitizer, or social service agencies, health departments, first responders, and the community. So it's really heartening to see that even though we're dealing with a shortage, we are learning different ways to be able to help out those who need it.
So, the one thing that keeps me up at night during COVID is the thought that this pandemic is already so catastrophic by nature. However, I live in earthquake country and you live in earthquake country, and we know that disasters always happen at the worst possible times. So, in my mind, I'm just thinking, how can all of this be made even worse for people? Do you ever think about that?
I'm right there with you. Having to deal with an earthquake and the associated tsunami response at the same time we're having a COVID-19 pandemic response and a nationwide one. So the normal planning processes are out the door where we would rely on other areas of the country that were unaffected to be able to help support us. Those do keep me up at night. We are coming into hurricane season and severe weather season in the Midwest. And what are we going to do when we have to shelter people under these social distancing guidelines? And then wildfire season is just around the corner. So whenever wildfires occur and we have to evacuate people, put them in the shelter, if it's happening during the pandemic response, we have a whole new set of problems. And as emergency managers, those things keep us up at night, but we also sometimes have the wildest imaginations, which can be a good thing when it comes to the planning process, but can also be detrimental sometimes when it keeps us up at night. But yeah, the last thing we would want to see would be to have another cascading effect of a disaster, especially a major one if it was an earthquake. And because we know that, well, what's interesting about that is we've got a lot of things in place, whether it's a field hospital or people who have stocked up on food, water, toilet paper, and other essentials. They have the stuff there at their house now. So that's a positive. But then having to deal with the infrastructure loss that we thankfully are not having to deal with right now during COVID. We still can telecommute, we have internet, that all that would be lost and compounded if we were to experience an earthquake or a tsunami.
We have had to really lean into our creativity and innovation over the last few weeks and months as we have responded to this global incident. What will you take out of this pandemic, both personally and professionally, as you keep helping your county and small and medium-sized businesses be better prepared for in the future?
Oh, that's a great question because, it's never too early to start writing lessons learned down for your after action report. I'll be frank, a lot of businesses were not prepared for this level of response towards a pandemic or a natural disaster. When I would help businesses, and we would talk about doing a tabletop exercise. Pandemic was never at the forefront. It was always an earthquake, a wildfire, or an active shooter scenario. And the problem with that is they never really viewed pandemic as, well, what would happen if more, two or more of my employees got sick? How would we continue operations? And now we're starting to see on a global scale the effects that a pandemic will have towards a business. It goes beyond having people call in sick at work. It goes into the economic impacts. It goes into the community-based impacts. It goes into supply chain, and we can go on and on. So I think what we're going to start to see now is a lot of things that we never thought were possible are possible. And what can we do to prevent that? We're going to start to see a lot of changes. And after this is all over, COVID's going to change the way we do a lot of things and interact with a lot of people. And so we're going to start to see a lot of different changes within the building of an organization and making it more resilient and ensuring that we have plans in place. Whereas COVID has done what it's done around the world, an earthquake, a tsunami, a hurricane can do the same on a more regional scale. And so this hopefully becomes a wake-up call that I would like to see for businesses and organizations to either bring on board emergency managers. We're starting to see a lot of that now ramp up in the private sector. I'd love to see that more. Or even smaller organizations that can't afford it, bring on call or emergency managers or on retainer emergency managers, at least to build them a plan and then practice it and then have it ready to go when a disaster comes in. I think this is the first time we're going to start to see this on a global scale where everybody is on the same picture saying we need to take preparedness planning for our business and our organization or our agency, nonprofit, very seriously and put something in place so that this doesn't happen again.
I'm right there with you. I think that we as humans tend to base our work processes and our imagination on what has happened in the past, and it's kind of hard for our minds to get out of that scenario. For example, with all of the active shooter incidents that have happened over the last few years, there's always been a huge request in active shooter response training and planning. But when that happens, other threat hazards get pushed off to the side, and this response is really allowing us to now finally see that everything is possible, especially with COVID having such a global scale. So I really think that this will help us unleash our creativity in disaster planning even further moving forward.
Yeah, agreed. Whereas, we have active shooter incidents or we have earthquakes, those no notice events that come on rather rapidly and they're high intensity, they can do just as much damage as a 30-day plus pandemic that affects all your employees, your customers, and your foreseeable operations in the future, but just doesn't come with as many news cameras or relief concerts. But as we're seeing now, is a tremendous impact no matter where you are around the world. So I think this is finally going to be able to open up the importance of emergency management in organizations, and then also promote the collaboration of, I've seen it in my county that I work with, the private-public partnership of not just large-scale industries like the utilities or the telecommunications or healthcare structure, but all the way down to manufacturing and retail and how those can work together with emergency management, both local and on a larger scale around the world.
Ed, thank you so much for speaking with me today and for sharing all of these great insights, and of course for everything that you do for your county during this COVID-19 response.
Yes, it was my pleasure. Thank you for the opportunity to be on your podcast.
I'd like to close off this episode by thanking my fellow emergency management colleagues around the globe. They may not be visible to the public, but they are working 12-hour shifts in emergency operations centers of jurisdictions, hospitals, and businesses. They truly are the heroes behind the curtains, managing and coordinating the information and resources for first responders out in the field. As always, if you enjoyed today's episode, I'd be grateful if you shared it with a friend or even wrote a review for the podcast. You can also follow the show on Twitter and Instagram. Thank you, and until next time, I'm your host, Lorraine Schneider.